Hi, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at Petability Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD 22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of MedcoVet, and I'm a proud sponsor of Petability. We decided to partner with Chris and Kathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At MedcoVet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With MedcoVet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them Petability sent you.
Your ilio-psoas can be re-injured and re-injured and re-injured if it's not rehabbed appropriately.
Welcome to Petability. I'm your host, Kathy Simon, certified veterinary technician and certified canine rehabilitation practitioner.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Hi, Kathy. How are you today?
Hey, Chris, I'm doing all right. What's going on?
I just woke up from a nap. I'm ready to go. Ready to go.
I've been really busy because I've been getting my dog ready. You know, my dog does nose work, right?
Mm-hmm.
And he was getting ready to do his odor recognition trials. And so there are 3 scents that he has to detect: birch, anise, and clove. And you go in one at a time. You do your birch, you do whatever, anise, and then you do clove. He nailed every single one of it. The crowd, the judges were thrilled. I was thrilled. I almost forgot to reward him because I was like, yeah.
I was going to say, the crowd goes wild for the bullnozer.
I was so proud of him. He did such a great job. And now my pug has a title. There's going to be no living with him now, honestly, now that he's got a title.
Barely any living with him before.
I know, it's barely living. Exactly.
He's got a very honed ego.
You know, I was just thinking just how much I love the sport of canine nose work, because from a rehab perspective, you know, in my mind, I watch my dog move and weave and change from side to side and shift his weight from side to side, go forward.
Kind of bow down.
Right.
Like,
yeah. Down. Exactly.
And up and yeah.
In my head, I'm like, every step is just engaging those muscles, ligaments, and tendons. And the sniffing is just increasing cerebral capacity. You know, from a rehab perspective, I'm like, this is pretty cool, because on one level, I'm bonding with my dog, which is fantastic. And on the other level, I'm getting him to move.
Right. But move safely. So when we did the nose work podcast a while back with Michelle Ellertson, you know, that was one of my angles, because, you know, when dogs, I was kind of in the agility world for a while, and when dogs can no longer do agility because their bodies had gotten injured, or, you know, they were just maybe aged out of it. Although there are accommodations that can be made, I think any dog can do nose work. You've talked before about your pug, you know, being in there with like shepherds and hounds and, you know, and go Mac, go. So that is awesome. And then the enrichment, you know, it's because that's how they see the world, is through their nose, no matter if their nose is brachiocephalic or dociocephalic. I love to throw out those words. Look them up. My audience, look them up.
I'm really proud of him. And our nose work instructor is just fantastic. And she guided us all the way there, you know, and maybe we'll compete in NW1. We'll see. So stay tuned. But also, I'd like to say that this is a little bit of a segue into our guest today, because we were just talking about, you know, agility dogs and how they may not be able to compete at some point because it's hard on the body. And there are lots of things that can happen to these sporting dogs. I think that's going to segue nicely into what we're going to talk about.
Absolutely.
Today, we are honored to welcome animal physiotherapist Laurie Edge-Hughes. I'm so excited that Laurie's going to talk to us because she's a highly regarded in the rehabilitation community, known for her significant contributions, both academically and in the practical realms of canine rehabilitation. And beyond her expertise, Laurie has played a pivotal role in educating and empowering individuals within our veterinary rehabilitation community and the dog trading community and dog owner community. Laurie's lectures are a personal favorite of mine, as I've mentioned before, Chris, because she seamlessly combines these hands-on experience with academic knowledge and a genuine commitment to continuous learning. But what you may not know is that not only are her presentations informative, but she delivers them with a little touch of humor. So they're always fun. So I always enjoy that. I love that Laurie is dedicated to ensuring that our canine companions lead happy and active lives. And throughout her career, she is focused on advancing the understanding and the practice of rehabilitation techniques tailored to our four-legged friends. And Laurie's expertise spans various facets of canine health, including, physical rehabilitation, canine fitness, and performance optimization. And today, we are going to be discussing with Laurie ilio-psoas injuries in dogs. And this is something that we see often in our practices, and it can be a little bit complex in its nature in treating it. So I'm interested to hear what Laurie has to say about how the ilio-psoas contributes to dog movement, the signs of ilio-psoas injury, and the treatment of an ilio-psoas injury. What does that look like? But first, Chris, let me just give you a little bit of background on Laurie before we get started. Laurie Edge-Hughes is a physiotherapist from Calgary, Canada. She began working with animals in the early 90s while studying physical therapy at the University of Alberta. Laurie holds a certification in canine rehab and a master's degree in animal physiotherapy, as well as 2 certifications in medical acupuncture, so human and small animal. Laurie taught the first canine physiotherapy courses in Canada, the USA, and Australia. She's a sought-after lecturer and instructor in North America and abroad. Her primary teaching platform is called 4leg.com, an online educational website. Laurie co-owns and practices out of the Canine Fitness Center in Calgary, Alberta, Canada. She also owns and operates Two Hands Physiotherapy, a small clinic dedicated to physiotherapy needs of the dog owners. And in 2020, she was awarded the inaugural Veterinary Rehabilitation Therapist Award by the International Association of Veterinary Rehabilitation and Physical Therapy. And in 2021, she was awarded the Medal of Distinction by Canadian Physiotherapy Association. In her spare time, Laurie sits on the boards of the Animal Rehab Division of the Canadian Physiotherapy Association, the Ontario Animal Owners Association, the Alberta Animal Owners Association, and the Registry of Allied Animal Health Practitioners of Canada. So please welcome Laurie Edge-Hughes to the show.
So happy to have you, Laurie.
Thank you so much for inviting me and for having me. That's great. And I laughed when, Chris, when you'd said, I don't know if you remember me. And of course, our claim to fame, you and I together, is raiding the pantry at a
Oh my God.
and be in the middle of the night because we were hungry and I had a special key to the VIP pantry. So yes, I remember you.
Yes. I love that that's what you remember me for. Nothing that has to do with canine rehabilitation,
No,
but
no,
late night
food.
snacking. Yes. All about
Food. I remember food.
So Laurie, why don't we jump right in, and maybe you can just start by telling us, what is ilio-psoas? Where is it located on the dog's body? Where can we find it? And what is its and where is its primary function?
So absolutely. Your ilio-psoas is known as the hip flexor, human, animal, otherwise. And so it is kind of on the a dog, because of course they're quadruped. So it's kind of on the underside, and it comes from the bottom of all of the lumbar vertebrae, the low back vertebrae, and depending on which anatomy text you read, some of the lower thoracic ones as well. It's kind of three parts: psoas minor, psoas major, and iliacus. So the psoas minor and psoas major are the ones that come off of the bottom, the undersurface of the spine. And then it combines with the iliacus muscle, which is, I guess, the inside, underside of the pelvis. And then all of this comes down and inserts just right there, just by the actual hip joint, very close to the hip joint. It's a very important muscle, and it can flex the hip. It can make the help you with a pelvic tilt motion. And, if the hip is stable, it can also help stabilize the lumbar spine. So it has a lot of jobs. And why many of your listeners might be interested in it is because it is a common injury in the sporting world and the working dog world. I'm going to say also dogs that live in slippery climates. So here, in Canada and the northern USA, where we've got snow and dogs are slipping and sliding on the snow when they're out chasing a ball or playing with each other. So it's a common injury. It can get strained with being out and running about. Now, also, I think it is likely underdetected in general veterinary practices. Our rehab practices, we're quite used to seeing this, but I think it's underdetected. And human literature and how we look at treating our ilio-psoas strains and really any muscle tendon strains, the healing can totally cross over to the canine patient, to the animal patient.
Laurie, what's the movement that is happening that's causing these injuries, is causing these strains? Is it the splaying?
I wouldn't say so much splaying out to the side, but more when the leg goes suddenly out backwards.
Gotcha.
So it slides out backwards. And then your other aspect, and especially with a sporting dog, can be overuse. And we'll see it also with dogs that are maybe compensating for something else. So maybe compensating for a knee injury, they might get not necessarily a strain of the muscle, but they might get trigger points in that muscle, like little fibrous knots in through there.
In my experience, I feel like muscles that connect to many different parts of a body in terms of their origins and insertion tend to be most vulnerable to strains. And I always try to take the opportunity to differentiate between a sprain and a strain. And sprain is muscle, tendon. Tendons hook the muscles to the bones, and then when the muscles contract, then they pull on the tendon and thus move the bone or stabilize part of the skeleton. And a sprain with a P is an injury to a ligament. So ligaments connect bone to bone and are responsible, I guess, for the overall stability, I guess, of our bodies, connecting our skeleton together. And some beings are more loosey-goosey and loosely ligamented and based on genetics and such, and others are very tight when it comes to their ligaments. I guess, with the ilio-psoas having all these attachment points and such that you kind of described, one of the issues that I've had is differentiating the diagnosis. How does one figure out that it's ilio-psoas, and is it the ilio-psoas is the primary injury? Or, as you mentioned, Laurie, is it a compensation for something else? Because oftentimes I've seen much interplay between the knee and the low back. And so can you explain a little bit about that, how we diagnose a problem with the ilio-psoas?
Absolutely. Actually, that's a fantastic point to bring up, because there are so many reasons either why ilio-psoas can be implicated, or let's just say a certain movement could be painful. So if I take your question and I spin it a little bit, and if we were to say, okay, so your ilio-psoas, you can stretch it, like it might get injured by overextending the hip. So as part of your assessment, you would extend the hip. And if that is painful, then you've got a number of reasons why that could be painful. So then you start narrowing it down from there. So it could be iliopsoas, but it could be pain in the hip. It could be a sacroiliac joint problem. It could be a back problem that is causing the iliosoas muscle to tighten up. And it could be a back problem as high as T9-10. Using the anatomy textbook that's my favorite, which was my father's, he was a vet, my father's 1955 Miller's edition to dissection of the dog. So I always like that one. So there's lots of reasons why hip extension could be painful. But if we go, we're going to start with, let's say, start with hip extension. So first off, your dog looks lame. Dog looks lame, so you're thinking, is it a joint? Is it a cruciate tear? Always the big scary one. Is it hip pain, hip dysplasia, hip arthritis? Then less common would be problems down in the hock. But if it's a sporting dog, it's a fit, healthy dog, we're definitely putting iliosoas into our thoughts. The dog is lame. If hip extension is painful, then like I said, I've got all those things that it could be. So then I'm going to go in and see, is iliosoas tender when I put my fingers on it, when I palpate it? So the way you get into iliosoas is all dogs have that little, it's the flap of skin that's just in front of their hip and in front of their leg. And you can usually kind of grab that flap of skin, and it's all dogs have it, and it's loose and mobile. So if you use that as your landmark, and then you kind of move your fingers just inside of that flap of skin, and you go upwards, or in veterinary terms, dorsally towards their spine, but just on the inside from that flap of skin. And you go slow, because if it's a strain of that iliosoas muscle, it's going to be painful. So if you go up slowly, and you're basically going to run into it. So it's not like a muscle that you're going to feel like you can grab the hamstrings or you can grab the quads. You're just running into it. And if that is painful for the dog, they're apprehensive, maybe there's the muscles are flickering before you even get to that space. Then we start thinking, okay, iliosoas is unhappy. Iliosoas isn't usually unhappy with a sudden injury to the cruciate or a sudden injury to the hip or a sudden injury, anything. So it almost, if it is painful and it's a new injury, you've pretty much, can say, well, this problem isn't 100% related to one of the other problems. Now, I have to be careful saying that, because of course you can always have two problems occurring at once. Oy, oy, oy. Okay, let's go back to iliosoas before we get into a whole can of worms. Okay, so let's say we have that. Now we have to recognize that the other reason iliosoas could be unhappy is if there is a pinched nerve and inflammation in the spine. So what I tend to do is I look both sides, so bilaterally, and I'm going to try and see, is it painful both sides? If it's painful both sides, I would say then the problem is central. The problem is the back. Now, if it's only painful on one side, it's more likely to just be an iliosoas strain. So let's see. I've stretched it, I've palpated it, and I've assessed both sides. And then, of course, I'm going down and assessing, the whole of the back, the pelvis, the rear legs, all of that. So I poke into it, and then I can also, when I find it, it's not just pushing into it, but more specifically, I'm going to kind of strum that muscle, and I'm going to strum it, as far forwards as I can, and then going back as far backwards as I can. If this is a very acute injury, as in it just happened recently or this last week, then the whole of the muscle might be upset and painful to touch. But if it's an older injury, or as it's healing, it might localize so that only one piece of it is tender. So if it's an older injury, or as I'm assessing this as it's healing, I want to strum the whole length of it and see, is there just one little piece of it that's tender?
Laurie, how can you strum the whole length of it when the bulk of the muscle is so hidden, so deep, coming off the bottom or ventral side of those spinal segments and the inside of that wing bone of the pelvis called the ilium.
You can definitely strum kind of over it throughout the lumbar spine. And then, yeah, it's kind of hard once because it starts to turn into a tendon. The psoas portion, psoas major, psoas minor, they start turning into tendon, and then they kind of join with iliacus, but it's down then more at that insertion point, down by the hip, where you can feel that tendony part. Technically, yeah, you likely could, stick your fingers on the inside of the pelvis, the ilium there, and palpate there. But it's not usually that meaty portion of it that strains. It tends to be the tendon. And like I said, oftentimes the psoas portion of it is where it's tender. I got to be honest, now that you asked that, I haven't seen tons where it's the meaty portion of iliacus. Yeah, it's kind of that tendony part when it gets closer to the hip.
So that's interesting because, as a physical therapist for people, I think that more practitioners are recognizing, there's like issues with the hip flexors and, are getting in there like with people, right? And it's never comfortable.
I think, these muscle injuries, and because I work in the veterinary practice, when I first started my career, I was at Angel Animal Medical Center in the radiology department, and we would x-ray thousands and thousands of dogs every year, and we would not see these thorough examinations like you see now. We would take a hip x-ray, we would go, I don't see anything, I don't see hip dysplasia, here's your non-steroidal anti-inflammatory drug, and you're on your way. So I think we've come a long way in understanding that muscle injuries in dogs exist and should be considered, because for a long time I think we did not think about treating soft tissue injuries in like the early 80s, in dogs.
Well, and even in the last 20 years, that I've been involved, I mean, we didn't talk about muscles in the early days. Again, when I equate it to the sports medicine practice on the human side, that's most of what we're treating is soft tissue injuries, whether it's a muscle, tendon, ligament, fascia, joint capsule, but it was all about like bones. And if you didn't see it in an x-ray, it didn't exist, right? As far as an injury. So
that's what it seemed like to me. Yeah. Laurie, are there any measures or preventative measures that we as owners can take to help maintain the health of our dogs, of the ilio-psoas muscle in our dogs?
I do believe yes. Firstly, would be warming up a dog before, going out and training for sure, or competing, or even you got to think about going to the off-leash park and just letting them run. So maybe you need to park a block or two away before, getting to the off-leash park, and then putting your dog on a leash and walking there and having them all woo wee woo, and at least increasing the blood flow before, unclipping and letting them run. So a little bit of warm up would be useful. So even if it's just, we would aim for at least 5 minutes, but even if it's just a little bit of excitement, a little bit of a walk, a little bit of anything that gets the blood flow going is going to be beneficial. And then otherwise, I think it's good for people to stretch their dog, and which is a nice, let's say just bonding for your average pet dog, but definitely for the sporting dogs and the working dogs to stretch out muscles, and so that they've got full extensibility. So we're not dealing with, a little shrunken up muscle and you want a muscle to be able to fully extend. Then beyond that, and in particular for our sporting dogs, I believe they should be doing some very specific eccentric exercises to condition the iliopsoas tendon and muscle. Taps into one of the things I like for treatment, but I think it's also one of the things that should be done preventatively as well. And so my favorite is the rear legs are up on a step or a stool. One of the easiest ways is to stop a dog as it's walking down the stairs, and when it gets so that the rear legs are on step number 2, and the front legs are on the floor. But of course, that only works if I'm visualizing a border collie. If we're talking about a Papillon or something, then it's going to be, you know, the last step, obviously, or something smaller. And then while holding those back feet on the stairs, or just putting your hand, you know, in front of their rear legs so that they don't jump off the step. And then you can encourage them with a cookie to lean forwards. And so what you're doing is kind of, if you kind of envision when a human would do a plank, you know, so that the hips are slowly extending as the dog is reaching forwards to get the cookie. And then you can move the cookie back under the chest. So now it's using the muscles concentrically. So we need to talk about that. So eccentric means that the muscle is still contracting, but it's controlling the lengthening. And I always say it's kind of like if you had a bucket that you're dangling over the edge of a building. Let's say you're lowering the gold bars down that you've just stolen, and you're slowly lowering your bucket of gold bars down to your partner in crime down below. I wouldn't be able to just, you know, let go of the rope, because then it would come crashing down. So I need to slowly control the length that I'm allowing that rope to go down. Now, the police come by and you want to haul your gold bars back up. So now you're pulling it up. You are doing a concentric contraction, which means that you are shortening the rope as you are contracting the muscle. So if we go back to the dog, so the back feet are up on the step. They are leaning forwards. They're controlling how much they are lengthening that ilio-psoas. That's eccentric. And then when you take the cookie under their chest and they tuck their pelvis in to get there, that's concentric. So I would have to say that is my favorite exercise as a preventative, as tendon conditioning. And then if there is a strain, and not in that super acute phase, but the next phase after that, that's my favorite exercise to treat as well.
How often are you recommending that these dogs do the eccentric and concentric exercises? Are this things that we do after activity, or is this something that people can aim for 3 times a week or 4 times a week? When's the best appropriate time to do that? Because I typically tell people, you know, if I'm exercising like that, maybe aim for 3 times a week, but you can do isometric exercises every day.
Mm-hmm. You know? Well, I would aim for your 3 times a week as well, right? And I looked up human research for conditioning, and it is crazily all over the map. And plus, when I added it all up, if we were to look at tendon conditioning, we're look at flexibility, we're to look at isometric, and let's say all the kinds of strengthening, all of this, I mean, we would have to, like, we couldn't have a full-time job if we were to then apply this to the canine athlete, right? So an athlete, you know, they might be lucky if they can have a part-time job, but I mean, we're talking the canine athlete, it's tough too. So I would say try for your 3 times a week. I would like this. I think this would be a fantastic exercise for pre-competition or pre-training as well for the ilio-psoas.
Think about how much fun it would be too for the dog and the owner to have this little exercise together. So we're getting movement and we're getting prepared. We're getting those muscles ready for dynamic movement, but it's fun too. It's fun.
Right. Anything to do with cookies is fun.
Right.
Yeah. How's this? I'm pretty sure I would be fitter if people were making me exercise with cookies.
So I have a couple of questions. So I'm assuming if you're doing this type of exercise for conditioning, then you would want to, you know, do a couple of sets and, you know, maybe bring that muscle to fatigue. So you're watching very closely, you know, a form is waning and that sort of thing. But if you're doing it as a warm up, then you would do fewer because you're just trying to get that muscle firing appropriately through its entire length. But you certainly don't want to fatigue it because you're it's right before you're going in and doing other types of physical activities. Am I right on that?
Yep. Even if you're to do it like 3 times, and for your preconditioning, right? Or for your workout, your pre-competition.
Yep.
I think that would be great.
Right.
It's really tricky for, the concept of training to fatigue. That's a tough one in dogs.
Yeah.
Because,
how do you know?
well, plus everything, like, so the 3 of us, as humans, we can go onto the quad, the leg extension machine or the hamstring curl machine, and we can work to fatigue, and that isolates one muscle group. There is nothing that we do conditioning wise for a dog that's going to isolate one muscle group.
Good
So
point.
everything is a combined
Right.
action. So I think you've got to factor that in, where it's like, well, it's not just the iliopsoas. We also need the quads to be working well. We
Right.
need the glutes to be working well. And as much as I talk about that exercising being iliopsoas, glutes have to work, abdominals have to work, the quads are working because they're angled down. You've got the front end that's activated. You've got supraspinatus and biceps preventing the shoulder from collapsing. So nothing we do in the dog world is isolated. So it's a bit trickier.
Right. So in that case, it becomes like the weakest link in the chain.
There. Yeah.
What are the long-term potential complications if an iliopsoas injury goes untreated?
Well, you know what? I was listening to another physiotherapist colleague, listening to her present on a certain technique, and we were talking about using this technique in reference to the iliopsoas muscle, and it was funny because she said, oh my goodness, people are always, oh, please tell me it's not a cruciate injury. And so they think they're happy when they hear it's an iliopsoas injury. And she says, I tell them, oh my gosh, oh, that's almost worse. Because your iliopsoas can be re-injured and re-injured and re-injured if it's not rehabbed appropriately. And you're not taking it through the various steps of rehab. And then my point where I harp a little bit is you're not taking, and especially the sporting dog or the working dog, you're not taking that animal back to the level it needs to be in order to do the job it does. So you have to get that animal not just to the point where it's walking and without a limp. You have to get it to the point where it can do what's required of it. It needs to be able to extend itself, right? So it needs to get to full flexibility in an instant, in a burst, right? From a stand to a go. And it has to be able to go like the dog is running, let's say a greyhound running. It has to be able to have that full extensibility. And then it has to be able to contract at the very end of its range, which is oftentimes where injuries occur. So it has to be able to accelerate, it has to decelerate it, it has to be extensible to its maximum, it has to be able to contract within all of its range. So you put the animal back into, well, let's just do a full trial at agility. Let's do a full round of agility where you've got that hyped up excitement and the dog is running on adrenaline. But if that muscle isn't ready to do its full job, that's where the problem comes in, where it can re-injure itself. So this is a very common re-injury. So it's a tricky one.
I think too, again, in my experience with rehabbing people that are athletes, nobody wants to forego their sport, right? They're competitive. And with the dogs, it's hard for them to empathize with their pet that can't speak. And sometimes this is so nuanced, and animals in general, but dogs, especially competitive dogs, you talked about the adrenaline, Laurie, and how they can hide it so well. And so ostensibly they seem fine. They think maybe, oh yeah, we rested for 2 weeks and then we're walking and we're doing a little bit of running, and they did some individual obstacles and agility, and now we're ready to put it all together. But every body has its time in terms of how long it takes to heal. And it all depends on how severe that original injury was, where it was, the type of tissue. And, again, if there's compensatory things. So, and then you have the whole, kind of psycho-emotional counseling of the owner that wants to get, back to competition.
As the rehab professional, I think it's important for us to give these owners things to do that takes into account the job of the dog as part of the rehab. And I think that's, it's likely our best chance of speeding up rehab is to look at and say, what do I have to get this dog back to? So I've got an example right now is I've got a dog with a fairly major biceps tear, partial, that is going for PRP, and the surgeon he's very pro rehab, and he's like, well, whatever Laurie says, that's what you're going to do. And of course, the owner wants to get this dog back, like, as oh my gosh, and she wants to push it. So one of the things we did is, I take this dog to the back of the exercise room, and I said, she's like, can I do this? Can I do this? Can I do this? I said, I said, you show me how your dog does healing. So it's obedience, not agility. Agility is a little bit trickier. So she shows me healing, and I'm like, okay, that's good. I said, yes, you can do healing. She says, can I do a go out? And I said, well, show me how your dog does a go out. And so the dog goes out, just goes boom across the back in my exercise room. And I'm like, oh, nope. You're not doing that one yet. So some of it is a matter of understanding the sport, understanding and watching and talking to our owners. And I think that's really, really important, is to talk to our clients about, okay, tell me what that looks like. How does your dog do that task? If I were to say, well, you could do weave pulls. Oh my gosh, my dog does weave pulls like a maniac. I said, well, what about a half set of weave pulls, or just, maybe put 2 or 3 pylons and let's see what that looks like. Oh, okay. Because then, so sometimes the other thing is a canine athlete knows their job so well that they will also look at, how can I do this? How can I compensate and do this, because I know the job that has to get done, and I'm going to figure out how to do it in such a way that I'm not even using that muscle. So you can also train incorrect movement patterns. So I guess one, I want all my rehab people talking to the owners. I want them watching, how does the dog do this, particular movement? Is this a safe thing for me to say, yes, you can do that, or not do that? And we don't want to get them doing something too fast where they develop a learned non-use. So I have to listen and watch and discuss to see what's appropriate. And that, I think, will enable us to be more specific to the sporting dog, but will also help to get compliance, buy-in from the owner. One thing I have learned with sporting dog people is, if I give them a range of, okay, I expect this injury to take, at best 4 weeks, but maybe at most 10, they hear 4. Always they hear 4. So I have learned not to say that low number. I say, I want you to be mentally prepared that this could take 12 weeks. And I said, now I will say, if we go through this faster, then that's great. But I need your brain to get its head wrapped around 12 weeks, because if we push it too fast, then we're going to yo-yo, or we end up back at square one, or we end up with an iliopsoas that is a whole pile of scar tissue that is going to set it up for failure again and again and again.
Along with kind of piggybacking on Kathy's question a while back. So if it's not treated, and let's say it's because we said hip extension, right, is how it's diagnosed, and it flexes the hip. So let's say it's a tight hip flexor, and they've learned to move with that tightness. What is the potential fallout in terms of, I mean, I know it could be anything, compensation of a front limb or, the opposite hind leg, but what are the most common? Because I typically think of like the joints above and below. Is there a correlation between like a tight hip flexor and a propensity for a cruciate tear or a quad strain or low back pain, mid back pain? Are there any correlates?
Not in the literature. Because I did a literature review a few years ago. So I will tell you, there's nothing in the research that says that for dogs. But you can, if you visualize how a dog would look if it's kind of holding itself, and I'm going to say tucked under itself, right? That little bit of a pelvic tilt because it's not wanting to extend. It's trying to protect that iliosoas. So theoretically, where I would look and potentially see other issues would be the more likely the contralateral stifle, the contralateral side, so the opposite rear leg. And anytime you have an animal that's offloading and then choosing to use that other leg more often, when it pivots, when it turns, when it pushes off, you have a chance for that other side to develop an injury. And in which case I would be concerned about cruciate and or an iliosoas on the other side. And then the other place that I have seen issues would be in the back.
I guess I've seen a lot of difficulty in, again, that differential diagnosis, cruciate tear or iliosoas, and, which came first. I also think that definitely low back pain. They're often tender in that, the thoracolumbar area. And so I just kind of think about peeling down the layers, in terms of rehab, assuming if that iliosoas is really fired up, then I'm going to assume that the other, the spinal pain is due to compensation or chronic tightness and, has just developed some trigger points and things like that. And I just want to be clear. So oftentimes with an iliosoas injury, it's a kind of a roaching, a rounding of the back. So like with that step exercise in the final stages, you are actually trying to extend. And so the contraction of the iliosoas is going to flex the hip, but it's also going to tilt the pelvis caudally and cause a rounding. And then when it's eccentrically letting go, but still working, then the hip is opening and the back is extending or becoming more of, let's say, a sway back for lay people.
Yep.
Okay. It's complicated stuff.
It's really so complicated.
Even if you start to visualize that dog that's protecting hip extension, so it's rounded in the back, it might be loading all of its weight to the front end. So in which case, well, supraspinatus, biceps tendon, any of the things where now you're asking the front limb tendons to do more work. Oh, there's a whole multitude of things that could go on.
There's a whole fallout.
Yes.
We're talking about a strain, right? And it can be, a slight overstretching, or it could be a tear. Is this strain, this injury, is it always managed conservatively? Do we have any other options, surgical or otherwise, to treat the iliosoas? And in terms of otherwise, it would still be conservative, but Laurie, have you had success with acupuncture, shockwave, laser, etc.?
Okay, so we'll start off with, is there a surgery to treat this? No. I mean, if it ever got down to a point in surgery, then you are talking about a super weird presentation, totally abnormal. There have been reports, like one-off reports in the literature of a fibrotic myopathy where the femoral nerve has gotten entrapped, where there might be a what's called a traumatic avulsion of the lesser trochanter, where the iliosoas insert pops a portion of the bone off. There has been 2 reports of like a tumor in iliosoas. So those would be the only times when maybe surgery would come in, but you would never have surgery as a primary thing, because what are they going to do? They're just going to cut it off. And the iliosoas is a pretty important muscle. So we can wipe surgery off of the list of potential treatments. So then we go to what does work. And And honestly, this is where I think it's so important for rehab to be staged. So your beginning stages is when you could use your modalities. So laser can be very effective. Ultrasound can be effective. Pulsed electromagnetic field, and shockwave. And I would say there's low dose shockwave when it is in that still very acute or subacute phase, because it's a little more uncomfortable and they're not going to tolerate it well. And you wouldn't want to use high doses of shockwave because it could be disrupting. But low doses of shockwave. But yes, so we have a radial shockwave machine, and I would use low doses of radial shockwave because it's actually good for blood flow and good for pain relief. So acute, I would definitely use any of my modalities in through there. And then I would also, in that acute phase, I would want isometric contractions. And isometric means that the muscle isn't changing length. We're getting it to contract, but it doesn't change length. So the simplest and the easiest thing to do in a dog would be a 3-leg stand, where you're going to lift the rear leg, the opposite rear leg off the ground, and just have the dog weight bearing on the 3 remaining legs. And that could be enough to at least get that muscle starting to contract. Super important for a little bit of, I call it low loads of normal stress through the affected structure. And this is what retrains the fibers to, as they are healing, as the fibroblasts are laying down their connective tissues in there, it helps them to line up. So you've got an injury and the body just splats down the connective tissues. The fibroblasts just lay out their collagen and their dull sploots in there, and it's disorganized fibers. So in order to help and expedite the healing process, you need low loads of normal stress through the affected structure in order for those fibers then to start to orient themselves parallel to the lines of stress that are going to have to go through that structure. So we need the muscle to contract, but not so much that it's going to do damage. And we need to put stretching forces through the muscle, but again, not so much that it's going to do damage. And that's what trains the body to line up the fibers so that they are going to be oriented in the way that is needed to withstand the stress that muscle or tendon has to be put under in order to do its job.
I think of a couple other things too when I'm thinking about the ilio-psoas, and one is the environmental factors. Like I will definitely go through with the owner. What is the surface that your dog lives on? And can we provide your dog with better traction with in the home? So areas of transition, the bottom of the stairs, at the food and water bowl. Do you have areas where the dog slips, splays, or falls? Can we put down rug runners? Can we use Dr. Busby's toe grips? So sometimes even just simple like modifications in the home can help with recovery or prevention of injury. But also I find that we were talking about modalities and laser and so forth. And I find that with my patients, particularly in the, patients who are acute, is that they do well when I introduce the dog to daily low dose laser therapy at home. And my go-to, of course, is the MedcoVet Luma. And I feel like I can really get a lot of good results there with that, with the dogs being more comfortable and recovering, well with that and tolerating it well at home because, they're at home doing it with their people. So just a couple of simple things there to add in.
Not just that they, they're not slipping and they're not doing damage, but it really ties into a concept, what we would call the psychosocial aspect of injury. That is a concept that is not well discussed in veterinary medicine. Animals' psychology and belief system, and as much as you say, oh, that sounds ridiculous, but you know what? If an animal has realized that, the last time I went down the stairs, it hurt. Right. So I'm going to hike this leg every time I go down the stairs, or I'm not going to go up the stairs because it hurts, or or I'm just on the linoleum or the hardwood floors. I'm not going to put that leg down because I can't trust it. So there is an aspect to the animal learning to trust its leg that I think you also get when you set it up for success.
You're speaking my language, because I talk about the emotional lives of animals on almost every single show.
Yeah.
And I'm actually in the process right now of becoming certified in palliative and hospice care for animals. And we talk a lot about the psychosocial aspects of animals that are at the end stage of their lives. But can you think about, just thinking about movement within the home and how isolating it would be if you're like, oh, I want to go outside and go for a walk, but I'm afraid to go down these stairs. And instead, I'm going to go sit under the coffee table, and how isolating that would be to an animal, and the role it might play in some of their, emotional distress.
So true.
Hey, Laura, before we wrap up, I want to go back to, you talked about stretching, right? As both preventative and a way to facilitate healing of the structure.
Mm-hmm.
Do you do both passive stretching and active stretching? And when does either come into play?
Our passive stretching, so people can visualize that, is going to be, the dog is lying on its side, and I, or the owner or whomever, comes along and, extends that leg out backwards. And I usually find if you run your hand down the front of the dog's thigh and you end up with your palm on the stifle, on the knee, and then you can get a nice, good extension of the hip. So that would be passive. And the trouble with passive is that it's difficult to understand what the animal is feeling then. You can pay attention and all the rest. So it has its place, and it's certainly something that can be done. I quite like an active stretch. And so for an active stretch for Iliopsoas, and an easy one for owners to do. And that's the other thing, is I want something to be easy. I want it to be fun. And I think if we have it easy and fun, we're going to gain compliance from the animal owner to actually do it, and for the dog to want to do it. I remember this dog back when I was doing house calls, and I had given this owner a stretch to do with his dog. And so gave him all this home program. And when I come back, I think it was 2 weeks later, I'm like, hey, how are your exercises and stretches going? He says, well, I do this one and this one, but I don't do this hip stretch. And I'm like, oh, that's likely one of the important ones. I said, why haven't you done that one? He said, well, the dog really didn't like it. And so every time I would come into the room, he would hide under the coffee table. And that just broke my heart. So I stopped doing that exercise because, it broke my heart that my dog was afraid of me. I mean, this was decades ago, and it was a real learning curve for me that I have to make these exercises fun. And it has to be fun for both the owner and the dog if I actually want them to do it. So my favorite exercise for the Iliopsoas stretch is the opposite of the exercise, where now I'm going to have the front feet up on a step or a stool, and the owner, standing above and encouraging the dog to take a cookie from up forward. So now they're stretching, their bottom legs are on the ground, the front legs are up a little bit higher, and they're stretching to take a cookie, and they're extending the hip, but it's not with the contraction, not the same contraction component. So that would be a way that I think I've managed to get more compliance, and especially that now the dog wants the cookie. So we can, the dog will stretch itself a little bit, and I can angle the cookie more to one side or the other to try and get them to wait, to ensure that they're weight bearing on that one affected leg. And now and this is where I take it back to, however, if this is in a really acute stage and the dog is not willing to extend that hip actively, then my better option is to do it passively with lots of awareness as to the dog's, how they are feeling. Are they exhibiting pain? Because stretching should be uncomfortable, but not painful. So I never want to just, pin your dog down and make him do this. That's never how we want to approach this. But a little bit of, oh, the dog is paying attention. That's okay. The dog cries or tries to get away. Not okay.
In the agility world, I see a lot of owners like pat their chest and have their dog come up, like stand on their hind legs, essentially. And I think if they're warmed up, to what you spoke of earlier in terms of, they've done some walking, they've done some playing, they've done some tugging, and the blood is flowing, that pre-competition, that could be a decent stretch, a very plyometric and active stretch.
Yeah, I would agree. And I would agree with you that I really I'm glad you brought up tugging, because that really is a good ilio-psoas worker as well. So that's a good way to warm it up beforehand. And then, yes, as you said, once it's warm, then you can go through an active stretch. Yeah. And I think your active stretch, unless you're dealing with an injury in the acute phase, your active stretch is likely your best way to go.
In the beginning, you said that you feel that ilio-psoas injuries and in general muscle strains are underdiagnosed. It seemed as though, when I was certified, back in 2004, that you didn't hear about these things. And then shortly thereafter, every single dog seemed to have an ilio-psoas strain. People were turned on to it. And I feel like it was more in the agility, community. And so then again, that differential diagnosis becomes, very important. But was there actually an uptick in ilio-psoas strains, or was it just an awareness? What are your thoughts on that, Laurie?
Oh, I'm fairly certain it was just awareness. I remember, when I was co-taught with a surgeon, she had said that, she says, is it that we're getting, that there are more cruciate injuries, or are we better at diagnosing the cruciate injuries? And I remember her saying this 20 years ago. And so I think that happens. I think that happens with a lot of things. We learn about something and it's like, oh my goodness, I had no idea that, you'd start looking for it. You start finding these things. And so there were likely ilio-psoas injuries before, and we weren't as good at looking for them. So there's that aspect. And then I'm going to put my caveat here. Whereas I think also dog sports have become more popular. Dog sports have become more complicated. So there might actually be more.
What are your thoughts on, we talked a lot about warm up, and I agree. I think they absolutely should warm up before their sport. But what do you think about a post cool down period after they run? Because I hate to see these dogs come off the agility course, or some of these working dogs that are high energy, and go right to the crate. I like to see them come off the course and maybe walk around a little bit before they get kenneled after their run. What do you think about cooling down?
I think the cool down is important. But I think where that benefits the animal or the person more is, cardiovascular, and allowing the tissues to dissipate the lactic acid and everything else that might accumulate in through that. I don't know that a cool down is what contributes more or less to a strained muscle, but I definitely think it's important from an overall health and taking the body down to its normal state.
Do dogs get delayed onset muscle soreness?
They can. What's interesting is that was one of the topics that could have been selected for. We got to choose one thing, between two things for individual papers that we were writing for when I did my master's in animal physiotherapy. And funny, that was not the topic I chose. I chose acute care. But you would think that the answer would be yes. I'm going to be honest, I have not seen research papers on that with dogs. There's likely more research that's looked into that with horses, but because I don't treat horses, I haven't looked into it. I mean, it makes very good sense why it could happen. And if we look at I'm going to say the human research, but if we look at proprietary basic research, I mean, most of that's done on mice and rats. So if it can happen on a mouse and a rat, and
Right.
it could happen on people, then of course it's going to happen with dogs.
And I guess the bottom line that I'm hearing is with the iliopsoas injuries that, it can happen in any being, especially quadruped, and it can be any breed within like the dog world, but there is a propensity perhaps toward an athlete or a working dog, but yet even a sedentary dog could slip on the ice or slip on a hardwood floor, and it could result in the same injury. So really it needs to be considered as a differential when there is any hind limb lameness.
Yeah, weekend warrior syndrome. I call it the potatoes. The potatoes can end up with this injury too if they have a sudden non-potato incident.
I told you she was funny.
So Laurie, any last thoughts? Something you want to leave our audience with in particular?
Oh goodness. Like I could just keep thinking, I could just go on for ages and hours here, but I would say just if you've got your lame dog, it's, certainly worthwhile having it evaluated from a rehab professional to look at all those nitpicky things and to see if you can find an iliopsoas or some other soft tissue injury, right, that needs to be rehabbed. And certainly if you've got a recurring injury, to find that right professional to identify it and take you through a rehab program. 2, to recognize that it's going to take a while to do a proper rehab program, and that you want the program to be staged so that it's like we do a little of this and then we challenge it a wee bit more. You do a little bit something else, you challenge it a wee bit more. So it should be staged, and very much so that when you get to that point where we're going to allow it to run a full course, that you have challenged it along the way to get there. And then I guess thirdly is the tendon conditioning that I think, and especially for our sporting dogs, to try and make sure that we've got a fully extensible iliopsoas muscle and that it's working at that extended range contraction, the eccentric contraction. I think that's our best chance at avoiding an injury.
As we're wrapping up, can you let our audience know where can they find you?
So my practice is based in Calgary, Alberta, Canada. And the website there is www.caninefitness.com. And that's all words, CANINE fitness.com. So that's my clinical practice. And then for the professionals out there, then I have a online educational platform that I created back in 2012 for our rehab practitioners to keep up to date, learn more, remember what they forgot from their classes. And that's fourleg.com. So www.fourleg, all written out, FOURLEG.com.
Laurie, I know you're super, super busy, and I really, really appreciate you taking the time, coming on the show, and may we meet again in a food pantry somewhere in the world.
Yes, that's good. It could even be an actual real restaurant. That would be good too.
Oh, well, could be, but not as fun. That was very clandestine,
That was very good. It was.
Yes.
It felt naughty.
I am so happy that you joined us today. I was so excited that you had agreed to talk with us. I've seen you lecture. I've been to your conferences. You're a wealth of knowledge. I love the way you teach. I love your teaching style, and I love your wit. And I've learned a lot. So I'm thankful that you joined us here today. And I hope that we get to talk to you again in the future.
Yes. Thank you so much for having me. It was good fun.
Thank you.
Thank you.
Okay.
Bye.
Take care. Bye-bye.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at Petability Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you, and tune in next time.